Knowing and recognizing two different things to a very real problem that faces so many women. And you know, depression is such a big word, isn't it? But there are two sides of depression. One is where it's circumstantial. It's because of what we're going through that we feel depressed. And as women, I think we're more susceptible to that because we have changing seasons. You know, when we're going through puberty, everything is raging. We haven't found ourselves. We can get depressed. We compare ourselves with others and we feel sad based on circumstances. Then we have children, and a lot of times we go through depression when we've just had our kids, postnatal depression, and then we shake it off, we rise up, we continue. And then we have another milestone. We hit menopause. And especially in the Indian context, nobody's ever said anything about it. It's like, it happens, yeah, but the impact of it, no one's actually talked through. That it changes the way we feel, we think, and may question who we really think we are. Because we were this way, and all of a sudden, we're not. We don't feel the same. And it's not just our bodies that's changing, but our mind is changing too. So circumstantial depression is a huge thing. And sometimes we can ride through it without external support, but very often we need a lot of support to get through it. The other side of depression is when it's a biochemical reaction or effect. It is not us choosing to be sad. Everything in our life should make us happy. And yet, we find ourselves sad because what's happening in terms of the biochemistry in our brain is not enabling us to have that feeling of happiness where we feel sad, we feel depressed. There are things happening in our lives. And so understand when we talk about depression that there are two sides of the same coin. So when you feel depressed, don't automatically assume that you have a biochemical disorder. Or if you have a biochemical disorder, don't believe that you have a simple depression that will go away without any intervention. You need intervention, either side of the coin. But it's more important when we have a biochemical disorder to get the right information in order to get the help that we need. And this morning we're going to talk to Naomi. Naomi, thank you so much for being here. And Naomi, tell us your story. How did you really discover depression in your life, and what did it look like?
Till I was 15, everything was perfect. I was good with academics. I was religious. Everything was good, and then I started having this. I started feeling low almost all the time. I found it hard to get out of bed, and I would binge eat, and I started skipping school. My grades dropped. I used to be like a stellar student, and then I started falling back on that. That's when I realized I needed help, and I told my parents that I need to see a counselor or something. They didn't understand. They were not like, you know, they were not educated enough on that matter, on matter of mental health. So many of us we don't know about it. Yeah.
So did they take you somewhere? Did you get the help that you needed at 15?
Not for like the next 2 years or 3 years. Yeah, and then I entered medical college, and in the first year, when I was writing my biochemistry paper, that's so funny.
You know, yes, the irony of it.
Yeah. I was handing my paper to my professor, and I was trembling. I started trembling all over. I had a panic attack, and I just fell, and he held me, and I was taken to the ICU, and he called my parents and told them that I need to be taken to a doctor to see I need to see a psychiatrist. So, and then the session started. So I'm still on medication.
So you saw a psychiatrist when you were in the first year of medical school.
Yeah.
And what was the diagnosis?
They generally don't, in India, they don't tell you the diagnosis directly, but I sort of squirrel it out of the soap.
Okay.
So, yeah. Bipolar is, you have this elevated moods and then you have low moods. It keeps on.
It's bipolar, which
Two
is
poles.
two sides by, two extremes. So you could have intense sadness, and then you could actually cycle to intense mania, rapid thought, rapid speech, fixation on certain issues. It's actually a biochemical disorder that needs medical intervention, and when you get the right treatment, it actually brings the highs and the lows together so you have stability. I think it really depends. We don't really want to explore the whole medical thing of bipolar in the few minutes that we have left here, but suffice to say that when there are things that are outside of the norm, that we need to actually investigate further and see what help a person needs. But in Naomi's case, the good thing is that you did go on the course and get the medical help that you needed. How did that help you, Naomi?
Medicines are very important.
Yeah.
I think without the medicines, I would have been just there,
Yeah.
I wouldn't have completed my course.
Yeah.
I wouldn't have the strength to get out of my bed. I would just be lying there. I would binge eat. That's all. That would just be me for the rest of my life, I think.
Yeah.
But thank God I found help at the right time.
Yes.
And I'm good now.
Yeah. And that's sometimes when we think of mental health disorders, we all have an image of mental health disorders, right? Come on, you can be honest. We've all seen people in the streets that are undiagnosed and unmedicated, and that's our image of a mental health disorder. So when we struggle or we go through difficulties, we can't relate the two because our thought, our image is that. But mental health doesn't look like that. This is what mental health looks like us. Real people, right? With real issues that really need to get the help. And when we do, modern psychiatry is advanced enough to get you exactly the help that you need for you to live a normal, healthy, fruitful, functional life. But it is an art. It is a science. You need to go to the right psychiatrist and get the right help. And I'm telling you, you need to be med compliant. Right?
Yeah, there was a time when I thought everything is going fine. I'm on medication. So I thought that if I stop medicines, everything is going to be just fine. I'm cured and all of that, I was happy. And I stopped medicines. I experimented, And then within a month or so, I had this horrible phase. I started crying. I was crying for 3 straight days, and I couldn't sleep. I didn't sleep for the nights, and I just went on crying and crying and crying.
So it's important to have the meds, be compliant in taking the meds. No shame in meds. You just have to keep taking it. You're feeling good because you're taking the meds. Keep taking it, and then you can live a fulfilled and a happy life.